Hi everyone. Today I'll be discussing the 2007 multi-state outbreak of Salmonella Tennessee infections, which were linked to peanut butter. So, to give a bit of background, this was the first reported outbreak of foodborne illness in the US due to peanut butter, which was considered low risk for contamination by Salmonella. One big issue was that cases began appearing in August 2006, but action wasn't taken to recall the products until February of 2007. This led to a widespread distribution of the contaminated peanut butter products and a spread of salmonella, which ultimately led to many cases of people having stomach flu-like symptoms that arise as a result of salmonella. So this is shown in the diagram on the right, which shows the vast amount of cases that occurred before the recall was finally implemented and cases began to fall. This outbreak originated in Tennessee, but quickly became a multi-state outbreak. As seen in the diagram, nearly every state had some cases of salmonella due to this outbreak. But later on, case control studies were conducted to determine that Peter Pan and Great Value peanut butter were the likely source of the outbreak. It was reported to be caused by contamination of peanut butter during production because of moisture from a leaky roof or a defective sprinkler system, which triggered the growth of salmonella bacteria. And finally, to provide some statistics, it was reported that 425 people were infected from 44 different states and 20% were hospitalized. Next, I'll give an analysis of the current situation. So, the main organizations involved in this case are the FDA and CDC. The FDA's mission is to protect public health by ensuring that various products are safe, ensuring our safety through regulations, and researching medical innovations. The CDC's mission is to implement preventive measures, respond to health threats, and serve Americans by researching and promoting healthy behavior. The decision to recall contaminated peanut butter brands led to a significant and immediate reduction in salmonella cases, but there were economic and cultural factors to be considered. The decision could have resulted in a negative impact on demand for contaminated food brands and a potential for negative public perception of food safety. With that being said, the decision did have strengths, weaknesses, threats, and opportunities. The obvious strengths were that the case control studies that were conducted to determine the source of illness and the subsequent recall of contaminated products immediately resulted in a decrease of salmonella cases. One weakness was that the cases began appearing in August 2006, but products weren't recalled until February 2007, which allowed the cases to be much more widespread. One threat was that the risk of salmonella in foods like peanut butter, which were previously considered low risk, was highlighted. And finally, an opportunity was that stricter food safety guidelines and implementation of steps to prevent contamination and kill any pathogens that are present in food could prevent further outbreaks similar to this. The root cause of this situation was simply poor regulation of food safety procedures. For example, the implementation of a kill step would prevent the survival of any pathogens present in products, and thus prevent an outbreak of disease. However, with regards to opportunities, this has led to increased media attention to the topic of food safety and has led to new measures being taken at the national and state levels to prevent outbreak. One example of this is that Georgia has passed laws to increase oversight and safety guidelines of food production, and Congress has been focusing on various safeguards, prevention, recall, and public food safety agencies. Now I'll analyze various alternative solutions. The solution in this case involved the recall of contaminated peanut butter products and an increase in oversight and safety guidelines with regards to food production. In this case, we can apply the theoretical perspective known as the social ecological perspective, which basically says that by understanding various levels of influence on an individual, public health officials can ensure that they're educated on what food brands are at risk for contamination. And this would allow individuals to be more proactive in preventing illness since they're aware of the risks. Public health officials can also work to ensure that regulatory frameworks ensure the prompt recall of contaminated products and that safety guidelines are more strictly enforced. Alternative solutions in this case that weren't used but I found from peer-reviewed literature include the use of a device which could better detect pathogens in food before an outbreak occurs. And another solution is oil-based sanitation in low moisture environments, since the use of aqueous-based cleaning and sanitation is not really ideal in facilities that produce low moisture foods. So this has the potential to be a very effective method of dry sanitation. In this situation, it's recommended that a combination of the current solution and alternative solutions be used. So this would include a prompt recall of contaminated foods, increased safety guidelines and regulations with regards to food production, and better detection of pathogens and sanitation. To establish an action plan, we would first have to recognize that the FDA, CDC, and USDA would be responsible to ensure that changes are made to prevent an outbreak similar to this in the future. Then, there are several steps that would be taken by each of these agencies. Immediately after an outbreak, the USDA and FDA would work to recall contaminated foods. Then, it would take several years for the FDA to create and implement new regulations regarding food safety. And currently, research and implementation of new methods of detection and decontamination by the FDA, CDC, and USDA is still ongoing. A similar case to this was in 1996 in Australia, which was the first recorded salmonella outbreak due to peanut butter. This the cause of this outbreak was mouse droppings in equipment, and the solution involved a case study that identified food sources, so that way they could be recalled to prevent further spread of illness. In my opinion, and to summarize, the solution in this case is far superior since it addresses the root cause of the problem, which is poor regulation of food safety, by ensuring that there are stricter guidelines enforced and that there are better methods to ensure that foods are not being contaminated during production. Thank you all for listening. I hope you enjoyed.